Good afternoon, everyone, and welcome to the May 2010 Public Health Practice Grand Rounds, brought to you by the Department of Health and Mental Hygiene and the Mid-Atlantic Public Health Training Center. I'd like to welcome everyone to today's webcast on urban rats discussing the problem. And before we begin today's presentation, I would like to invite all of those of you who are watching online to visit our website to see what trainings we have online, including our public health nursing training and a whole list of our previous webcasts that are also archived there. And it also draw your attention to the June trainings that we have coming up that are face-to-face trainings, including investigating environmental public health complaints, trespass, warning letters, and the law with Bernie Penner, ethical problem solving with Kay Edwards, managing multiple priorities with Deborah Smith, and next month's Public Health Practice Grand Rounds on June 19th on reducing youth violence in schools and communities with Dr. Phil Leaf and Jonathan Bryce. And we'd also invite those of you watching online to please email any questions you may have during this webcast to our email address at maphtc@jhsph.edu, and also ask you to please sign in so that we know how many people were watching today. And with that, I think we can go ahead and introduce our speakers for today. First, Dr. Gregory Glass, who is a professor of infectious disease ecology in the Department of Molecular Microbiology and Immunology and Epidemiology at the Johns Hopkins Bloomberg School of Public Health. His research interests primarily involve studies of the maintenance and transmission dynamics of infectious agents, especially zoonotic agents. His work includes both laboratory and field research of animal reservoir and arthropod vector populations, as well as epidemiologic studies of affected human populations. The goal is to better understand the reasons for the persistence and emergence of infectious diseases. In addition to traditional field and laboratory studies, he uses GIS to study environmental correlates of disease risk. Much of his current focus involves developing integrated statistical spatial models for disease risk assessment. His GIS laboratory coordinates the study of anticipated geographic changes in infectious diseases for the Johns Hopkins Malaria Research Institute. And Dr. Catherine Feldman is also with us today, who is the state public health veterinarian and chief of the Center for Zoonotic and Vector-Borne Diseases with the Maryland Department of Health and Mental Hygiene. Dr. Feldman was awarded her veterinary degree from Cornell University and a Master of Public Health degree with an emphasis in epidemiology from the University of California, Berkeley. She is a diplomat in American College of Veterinary Preventive Medicine and earned her certification in the epidemiology specialty of that college. Her responsibilities include the surveillance, investigation, and control of zoonoses and vector-borne diseases in Maryland. Her professional interests include public health issues that arise in the human-animal interface. And with that, I will hand it over to Dr. Glass.
Thanks very much. Do I need this microphone or?
Yeah, I think you do for the webcast.
Okay, great. Well, then we will stick with that. Okay, thank you all for being here today. To discuss a topic very much akin to driving by an accident on the interstate. It's rather gruesome, but you can't help but just slow down a little bit and think about it. If you are a Norway rat, you are very much, or a rat in general, particularly in urban areas, you feel very much the same way that Charlie Brown does. You might have a few more friends than Charlie Brown, but not a whole lot. In fact, urban rats typically represent one of the most commonly reported quality of life issues reported in community surveys about quality of life, even though those studies oftentimes have absolutely nothing to do with rats themselves. So we probably should start out first by talking about what rats are. Because in fact, there's a large number of species of mammals that are considered to be rodents. Actually, almost half the mammals that are known today fall within the order Rodentia. And in essence, rats are nothing more than big mice. If you want, they're the mammalian equivalent of germs that the layperson typically describes about pathogens and so on and so forth. They have no real biological meaning, but if you say rats, most people know what you're talking about. More specifically associated with urban problems are rodents of the genus Rattus, of which there are fairly, at least for mammals, a fairly large number of species, on the order of about 50 or so. And there are also a large number of other closely related genera that are tightly related with Rattus, all of whom originated in Central and in Eastern Asia. And so this old world group of rodents really represents a very long historical, actually evolutionary relationship in many cases with human populations. Now, we're not going to talk today about rodents or rats and mice associated with the New World, North America, Central America, and South America, but we have indigenous species of rats as well. In fact, when we really talk about urban rats as a problem, we're typically only talking about 3 species within that genus Rattus. We have the Pacific rat, or the Rattus excellens, Rattus rattus, the black rat, which is famous or infamous for being associated with the outbreak in the Middle Ages of bubonic plague that swept through the Middle East and Europe. And what I'm really going to focus most of my conversation about today, because in urban areas, particularly north of about Richmond, along the eastern coast, the Norway rat, or the brown rat, Rattus rattus. In all cases, these 3 species of rats have been distributed globally or nearly globally associated with human movements. And so, for instance, it's not atypical if one goes down to the Inner Harbor to see ships tied up at the dock with, in some cases, they have rat excluders, which basically are simple physical barriers to keep rats from moving on or off the ships. But as you can see, rats themselves are really quite adept at being able to move associated with human activities. Now, there's a number of challenges associated with what are referred to as synanthropic animal populations generally. These include things such as pigeons, which are oftentimes referred to as flying rats, and rats themselves, and mice, and so forth. These animal species all tend to rely on human activities and affect the quality of life for people that have to experience them in the environment. And these impacts can range from infectious diseases, and I'll spend a bit of time towards the end talking about them, specifically because that's part of my interest, but also because those are the easiest to document. The other impacts in terms of damage to infrastructure, food loss, contamination of water resources, and physical damage are all anecdotally reported, but it's very hard to find actual real documentation in a regular way as to what the true impacts are. But needless to say, people perceive that they have these effects. And so much of the attempts that have gone on historically have been trying to find ways to reduce the burden that these animals impose on human populations. And this led almost 60 years ago in this country to very detailed studies, actually beginning here in Baltimore with David E. Davis and John Emlin, to try to understand the basic biology of rats and how that might come into play in terms of controlling the rodents, leading to what's referred to nowadays as what's recognized as integrated pest management. And that is coming up with a mixture of strategies to try to reduce the burden that these animals pose. Now, these 2 maps represent results reported to the city in terms of sites where rats were found in 2007. And about 10 or 12 years previous to that, actually, I can't do my math very well, about 18, almost 20 years previous, in terms of rat complaints reported in the late 1980s going into 1990. And what this ought to suggest to you, simply looking at them at a gross scale, but even if you were to do this at a very localized scale, is that infestations of these rodents persist in a very regular way. They simply are not particularly amenable to interventions. And so the idea that we've tried to develop strategies at one level, if we want to look at the glass as being half empty, suggests that we really haven't been very successful, over the last 60 years in coming to grips with the problem that these rodents cause for inner city human populations. And there's a number of reasons that have been proposed as to why the problem hasn't been resolved. And the first is simply the fact that because it's viewed as an insoluble problem, this becomes a self-fulfilling outlook at all levels of society, both for people who live in neighborhoods where rats occur, and they come to view it that this is a problem that can't be resolved, all the way up into the government, where the idea is that they haven't been able to solve it, and so why continue to put resources into a problem that can't be solved. The other, of course, is that there are a number of other social challenges in urban areas that we often have to deal with in terms of issues related to such as crime and education and providing basic services to the population. So that although rats or rat infestations are viewed as a big problem, they don't rise to the level of other competing interests. And to the extent that those are more or less important, we could probably talk about that later. What I really want to focus on is the third point, and that is the basic biology of the rats themselves and why that has an impact on our inability to deal with these animals. And what this graph and figure shows, if I can find the arrow, is Baltimore City surrounded by the Beltway, a number of sort of arbitrarily identified areas. Indicated here on the x-axis are these areas that are sampled and the estimated sizes of the rat populations. And what I want you to take home on subsequent years is that within any one site, the numbers don't change very much from one year to the next. They're actually remarkably stable for a wild animal population. But there's a lot of variability from place to place. And so one of the questions is, why do you see spatial variability in the abundance of rats in an area, yet any local area tends to be remarkably impervious to alterations? And to understand that, we actually need to go back to some of the early work by Davis and Emlen to take a look at what happens with rat populations in the environment. And the first is shown here in the upper left, and that is looking at, over a period of about 10 years, here on the x-axis, abundance on the y-axis, 2 alleys in which various interventions were tried, such as trapping rats, poisoning rats, and so on and so forth. And what you ought to notice is every time that there's an intervention tried, the rat populations respond very dramatically, with typically a rapid fall-off in numbers, but almost an equally rapid return back up to the abundance that occurred previously. And so these sorts of interventions seem to have a relatively short-term impact on population. So if you're a politician trying to get elected, perhaps these are good to do right around election year, but they really don't impact the problem in the long term. It's really only with the introduction of sanitation efforts that Davis and Emlen were able to show that the populations of rats decrease rather dramatically. And this is simply reiterated here in more detail, showing that with pre-intervention, the population was at this level. Following a very rapid elimination of the rat populations, the population stayed absent for some period of time, but then rebounded back in the absence of any other intervention back to where it had been previously, or maybe even a bit higher. So these are populations that respond very dramatically. And in part that's driven by the fact that this stability in numbers hides a very dramatic turnover in the rat populations themselves. Rats are have a very short lifespan in the wild once they move out of the natal nest, typically living less than 2 months on average. And they're susceptible to a wide variety of causes of mortality individually, but the population doesn't change too much. Part of that is a reflection shown down here in this bottom figure, that rats don't move very far themselves. They actually are really quite stationary once they become established in an area. So on the x-axis here are distances in tens of meters, and this is just a histogram showing that typically rats are moving on the order of about 10 or 20 meters between observations carried on over periods of nights. Part of what really drives then that dynamic, if rats are dying very rapidly, is they must be reproducing very rapidly as well. And females are very fecund in terms of producing relatively large numbers of offspring per litter. They have this propensity to breed with multiple males in forming a litter, and also biologically undergo what's referred to as postpartum estrus. So immediately following the birth of a litter, the female comes back into estrus again, and typically within the order of 9 to 24 hours will breed again. And so in essence, she's pregnant while she's lactating and nursing the previous litter. So this combination of breeding with multiple males and seeking mates over broad range actually results in a great deal of stability if there's any sort of local perturbation. So even if many of the rats are killed in a single alley, any surviving females will simply be able to find mates, if you will, sort of elsewhere. And that's what's shown here in this figure. Here are the main streets in an unidentified area in Baltimore with the central alleys where the rats tend to congregate and hang out. The circles here represent 5 different females, and the lines connect the females with the males that they mated with for that particular litter. And so you can see, for instance, this particular female here found a couple mates up here and then proceeded to pass over this block. I guess there wasn't anybody interesting there that night, and mated with a couple males down here. And so this is actually a way of stabilizing the population. Also, it's a great way to spread around pathogens, as Dr. Rompalo talked about last month. So what keeps rats going? If they're synanthropic, they basically, in essence, rely on people. And so the issue is most of the access of resources that rats rely on are available in rapidly renewed and constantly renewed excess food that humans put out. If that food isn't available, although it's pretty hard to imagine in some circumstances, such as here, that the food runs out, and they're more than willing to graze on vegetation and other sorts of materials themselves. And typically they pick up water from damaged infrastructure or water that gets put out by individuals as part of activities of daily life. So that provides the food and water. And shelter is an issue in which rats will typically find anything or a wide variety of sources in which they can seek shelter. Norway rats themselves typically are subterranean in terms of building nests. This is an alley up north of the school a number of years ago, and these arrows represent entrances to alleys. So not only will they burrow, but you'll see they'll do it in relatively close proximity to one another. So they actually will pack these populations in quite densely. Now, as I mentioned, part of my interest is in infectious agents. And one of the other issues is it's very hard to document issues such as damage to infrastructure or food spoilage. But it certainly is striking the number of human-associated pathogens that can be identified with these rodents that live in close association with humans. And this simply shows, this is some work from Judy Esterbrook, who did this work with Sabra Klein a number of years ago, looking at just a catalog of different pathogens that can be transferred to humans and the prevalence with which they occur in the rat population, wild rat populations in Baltimore. And for those of you who really know your pathogens, I simply point out that this lymphocytic choriomeningitis virus, which does not infect rats, actually infects house mice typically, was thrown in because basically they were finding every pathogen they looked for and they needed a negative control. So they convinced themselves it wasn't them that was the problem, it really was the rats. Just to go on a little bit further with another laundry list, these happen to be agents that can be transferred not necessarily to humans, but to companion animals and laboratory animals and so forth. And you can see again that these, wild rats serve as natural reservoirs for a diverse array of pathogens. And so that brings us to the issue of what do we do about rats? And the idea of controlling or eliminating rat populations has been one that has been on the table, as I said, almost from the beginning of detailed studies in the 1940s. And various proponents have subscribed to different strategies. Certainly one of the most direct ones was the idea of directly eliminating the rat populations by poisoning or something of the effect, increase the mortality of the rat population. Subsequent studies, such as those by Davis and Emlyn, suggested that maybe what you really want to do is alter the environment, make it less suitable for the rat populations, drive down the populations to low levels, and either the rats will disappear by themselves, or you might then proceed to introduce some sort of direct reduction in the population, such as poisoning, by combining these strategies together in what's referred to, as I mentioned, as integrated pest management. And the basis for this, as I described in an earlier slide, were these sorts of long-term studies looking at what the effect of direct targeting of populations were, that they were generally of very short duration in their effectiveness. They could reduce populations rather dramatically, but they didn't last for very long if the environment wasn't changed. This was followed up now about 10 years ago by some studies done by Baltimore City that are characterized over here on the right-hand side in this study. And what this was a series of community-based interventions in which entire neighborhoods were treated according to integrated pest management strategies. The Zone 1 described here included almost 850 households. Zone 2 had almost 900 households. And you can see some of the characteristics associated with surveys of the local environment, looking at the infestation of rats in the areas, whether there were factors that were associated with the environment that would provide food to rats or shelter to rats and so forth. And the idea was to go in and do these interventions and see, did it have an impact on the local rat populations. And you can see over the 6 months of the study, in both cases, you got a rather dramatic reduction in the abundance of rats. This included not only changes to the environment, but also introduction of targeted poisoning. And so you could drive the rat populations down. In follow-up 6 months after the study, so a year after the study was done, in Zone 1, the level of infestation had returned to about what it had been at the start of the study. About 20% of the properties had infestations. So again, the idea that Davis had already told us, these were relatively of short impact if you couldn't get people to change their behaviors. It was rather striking, though, that in Zone 2, on follow-up 6 months after the end of the study, the rat population locally had disappeared. And so a little bit more sophisticated reading of those studies suggests that it's not a matter that integrated pest management doesn't work, it's that it works under some circumstances. And the question is, or the issue is to identify what those circumstances are likely to be. And so what this suggests, though, then, is that population treatment can be successful as part of an integrated pest management strategy under a limited set of circumstances. It is not a panacea. We need to come up with some better strategies. I couldn't help but throw this picture in. This is at a renovated household up on Druid Hill. And if you see what kind of looks like turf growing in, that's actually rat poison. I estimate there's probably about 25 pounds of rat poison spread out in this 10-foot wide backyard. And if you really knew what you were looking for, you would see there's a rat burrow here and there's a rat burrow here. So clearly it doesn't work all the time either. The rats were out there that night dancing merrily across these little pellets. So the challenge that we really face in dealing with this relatively unanalyzed, unsolved problem is that we're really going to be unlikely to be able to globally eradicate rats associated with human populations in urban areas anytime in the future. And so what we have to really begin to refocus this problem as is what's a sociably acceptable level of infestation? Is one rat too many? Or should we kind of look at them as tree squirrels without fur on their tails, for which we maybe don't want to feed them in the park, but we would be willing to tolerate to some extent. If we can identify what that socially acceptable level of infestation is, then we can perhaps identify what a cost-effective strategy for a community is that can be incorporated into parts of daily life that reduces the rats to that level. So with that, I will stop and turn this over to Catherine.
Fabulous. Well, thank you very much for the invitation to speak today. I'm glad to be here, and I think this was a nice discussion of Dr. Glass framing the urban rat problem, and then I'm going to try to place this in a public health context, how we address this at the health department. So what I am going to talk about today is the public health structure in Maryland, so you have a sense of the context in which we work, and then describe some of the activities that go on surrounding rats, and those will include rat complaints and inspections that involve rodent components, as well as some disease investigations that also have rodent components. And then I'll leave you with some resources in case you want to learn more about rats. So who are we? Well, we're the Maryland Department of Health and Mental Hygiene, so that's essentially the state health department. And within that health department, we're the Infectious Disease and Environmental Health Administration. Within that, we're the Office of Infectious Disease Epidemiology and Outbreak Response, and we're the group that would respond to a foodborne outbreak or would help establish H1N1 clinics in all the various counties, investigate diseases associated with rats. So we really are the Infectious Disease Epidemiology. It's very descriptive, our name. And then finally within that, the Center for Zoonotic and Vector-Borne Diseases. And I'm sure this audience is familiar with zoonoses. Those are diseases that are naturally transmitted between humans and animals. Vector-borne diseases are diseases that are transmitted by arthropod vectors, mosquitoes and ticks typically. So the mission of the Infectious Disease and Environmental Health Administration is really to reduce transmission of infectious diseases and protect individuals and communities from environmental health hazards. Again, the Center for Zoonotic and Vector-Borne Diseases within the Infectious Disease and Environmental Health Administration is really got a mission focused on the control of zoonotic and vector-borne diseases. We spend a lot of our time on rabies, but we also spend a lot of our time on some of these other diseases. This picture here is yours truly, maybe not so recognizable, but the individual I really want you to see isn't quite so obvious, and that's a Norway rat. And this is one of those disease investigations, human disease, investigating tularemia, looking for mammalian reservoirs of Francisella tularensis in the community. And we did find seroevidence of tularemia in maybe this rat, can't quite remember. So in Maryland, the public health structure is set up with the state health department that I just described, but then there's a lot of capacity in each of the 24 local jurisdictions. So those are the 23 counties and the city of Baltimore. Each of those jurisdictions has a very competent local health department that's really the boots on the ground. They're the folks who are doing the disease investigations, going out and conducting inspections, and in many senses, the state provides a role that's more consultative and provides guidance and expertise to individual situations. So I just wanted to make you all aware that there is this tiered structure, if you will, of the local health departments, the state health departments, and then of course if we need it, we can go to the next level up, the federal level, to the Centers for Disease Control and Prevention to get additional insights and guidance. So the activities I specifically want to discuss today are those that occur most commonly at the local level, the environmental health or the sanitarians who conduct investigations or deal with rat complaints, who also conduct inspections. And then I also want to discuss one disease investigation in particular, but I think that investigation is going to be illustrative of how all of these various levels of public health, the local, the state, and the federal, as well as other partners who we draw on for their expertise, can get involved in investigating some of these diseases that are rat associated. So I'll first start by discussing the rodent complaints, and this picture is a story in and of itself. If you can't see our featured guests at the bottom, there are three of Dr. Glass's favorites, the Norway rat. This is from Anne Arundel County, and this picture was generated after a complaint came in for rats. So somebody complained to the local health department about rats. And on investigation, what was determined is that this was an abandoned property, and a well-intentioned but perhaps misguided individual was trying to feed the local feline, the cat population. But as you can see, when you put food out to feed one population, there's nothing there that says cats only. And so you have any number of other visitors, wildlife visitors, coming and benefiting from this free and available cat chow. This is a great way to transmit diseases between individuals within one species, but also across species. So there's a lot of lessons that can be taken from this photo. You can also see here who's the dominant species. The cat has to kind of sit back and wait for the rats to get their fill before the cat can move in. So I wanted to highlight two different counties. I mentioned that there are 24 jurisdictions in Maryland, and so I thought for the local perspective, I would highlight two of those jurisdictions. One is the Baltimore City, so not technically a county, and the next will be Montgomery County. But I'm sure many of you are familiar with the rat rub-out program in Baltimore City, and I also want to make sure I acknowledge the folks in Baltimore who provided this information to me, as well as the folks in Montgomery County and Anne Arundel County who also helped inform this presentation. So the rat rub-out program is exactly that. It's a rub-out program against rats. We all know that rats are a concern in Baltimore. And it has recently moved from the City Health Department to the Bureau of Solid Waste within the Department of Public Works. And this move was really instigated by the recognition that this would allow some greater synergy with other sanitation programs, so that it's not just looking at rats in isolation, it's also thinking about how rats might take advantage of abandoned properties and allow for that greater synergy to occur. Just to give you some idea of the context that this group is working in, there were 28,000 rat complaints registered in Baltimore City in fiscal year 10. That's 28,000. That's a huge number. In addition, there were 42,000 vacant, abandoned, unoccupied house cleanup requests that occur each year. So there's a huge volume of complaints that need to be addressed that involve rats. So what happens in Baltimore City? Well, say you are concerned about rats. You'll call 311 with your complaint, and the city will come out and they will inspect and they will identify where rats might be living. They'll look for the burrows that Dr. Glass showed us images of. They will actually put out rodenticide, they'll bait, and then they will leave information to educate the community so that they can then go ahead and implement their own measures, such as ensuring that garbage is contained in well-lidded trash cans, et cetera, et cetera. The city will then provide additional follow-up approximately 3 weeks later, and if indicated, will rebate. Now, as part of this synergy with that's generated from moving to the Bureau of Solid Waste, now whenever a complaint is made about a vacant, abandoned, or unoccupied property, the city will go out and clean up that property, and once cleanup has finished, they will also put out rodenticide, they'll bait for the rats, so that's an automatic part of cleaning up abandoned, unoccupied properties. Again, remember the volume of complaints we're talking about, 28,000 in 1 year. For rat complaints alone, 42,000 complaints about vacant, abandoned, or unoccupied properties. Now, in addition, the program has a rat rub-out educator, and this person's role is to be proactive, so not wait for those complaints to come in, but to go out to identified hot areas and leave information, attend community meetings, knock on doors, engage the community in ways that they can implement some of the control measures that Dr. Glass mentioned earlier. This is the latest rat rub-out brochure from the city, and you can see that it highlights just very simple approaches to controlling the rat population, but obviously from some of Dr. Glass's photos, not always implemented. So durable trash cans with tight-fitting lid, remove leftover pet food and animal waste every day from the back of your yard. Don't give rats a place to hang out, and don't give them food and water. Now I'll move to Montgomery County, Maryland, which is a very different environment. It's urban, suburban, very large geographic area, very different from the city of Baltimore. And on their website, and the left side of the screen is just a screen capture that shows some of the information that Montgomery County Department of Health and Human Services posts about rat controls. They give you a link, what to look for, so that you know what to look for with respect to rat burrows and problems for potential food sources for rats. And then the Chapter 39 of the Montgomery County Code, which says it shall be unlawful for anyone to allow their property to be infested with rats or to be in such condition as to contribute to an existing or potential rat infestation. Now, Steve Haynes at the Department of Health and Human Services in Montgomery County provided me the data on the number of complaints. Again, these might not all be valid rat issues, but these are the number of rat complaints by year in Montgomery County. And you can see the magnitudes of difference to the city of Baltimore. On average, 828 complaints from 1994 to 2009. You might be wondering what happened in 2004 with that big spike, and if you were thinking it was the year of the periodical cicada, you would have been right. And what Mr. Haynes reported to me is that we saw rats eating cicadas off trees. And so there was an abundant food source, and the rats took advantage. And as such, there was a huge spike in rat complaints. Not surprisingly, the number of rat complaints jumps up in the summer months, and you can see that from this peak on this graph here, that with the food sources out there, the vegetation, as well as people just being outdoors more to notice them, the number of rat complaints does go up by month, most commonly in the summer. What Montgomery County does when they have a complaint from a county resident is they go out, they'll actually go to the property and they'll try to find where the rats are living, how extensive the infestation is, and what the food source is for the rats. They'll give recommendations to the property owner, and if indicated, they'll actually recommend rodenticides that the property owner can purchase and apply themselves, or if they feel the problem's too large, they'll suggest hiring an exterminator. What they won't do is actually place rodenticide themselves, as does Baltimore City. So I just thought I'd show you these two different jurisdictional approaches to rat issues, and of course that's going to be how they approach rat problems is going to be based somewhat by how big the problem is in their jurisdictions. I did want to briefly mention other inspections that go on, typically at the local level, not always local Department of Health. It may vary by jurisdiction as to what agency is responsible for these inspections, but there are inspections that are conducted periodically, whether it's yearly, every 2 years, of restaurants, multiple dwelling residences, campgrounds, pet stores that are going to have a part of the inspection checklist be looking at rodent problems. Again, this authority may vary, so if it's a multiple dwelling inspection of, say, a hotel or an apartment building or something, it may be the Department of Housing that gets involved. But all of these inspections do have a rodent component, and the actions that may result from these inspections, if a rodent problem is identified, may range from just ensuring that appropriate rodent control is taken. They might come back out in a month and make sure that the rodents there's no further evidence of rodents, to actually shutting down the facility, depending on the type of facility and the type of problem. So I just needed to highlight this little part too as a public health activity. Now I want to move into the part of the presentation that deals with disease investigations that have rodent components. My initial intent when I started working on this presentation was to maybe hit a few different diseases on this list, give you some background on the diseases, and then an example of a public health investigation. And then I realized how long that would take. And so I've decided to just emphasize one disease. But I did want to mention, as Dr. Glass already showed with his list of the evidence that is found in rats, that there is a very large list of human diseases associated with rats. And so let's see, leptospirosis, commonly transmitted in rodent urine. Hantavirus, that's the one I'm going to talk a little bit more about, so I'll skip that for now. Plague, very much in the United States. A lot of people think that plague is not actually in the United States. It was introduced into the U.S. in 1901 from a rat that came in on a ship in San Francisco. So plague is very much here in the U.S., predominantly a problem out in the Southwest, but introduced because of our friend the rat on a ship. Rat bite fever. This is a very rare disease. It's not notifiable in Maryland, so we're not actually sure of the incidence of it, but we did have a fatality associated with rat bite fever a few years ago in Maryland. I already mentioned tularemia from that photo earlier, but tularemia has a huge range of mammalian reservoirs, potential mammalian reservoirs or mammals involved in its transmission, and rats are just one of them. salmonellosis, what doesn't get infected with salmonella, and then murine typhus, and so the list goes on. I didn't mention hepatitis E, there's plenty more. How are rodent diseases transmitted to humans? Well, a number of different ways, through inhalation, either of aerosolized feces or urine, ingestion of food items, water contaminated with rat urine and stool, or via direct contact from infected tissue, through bites, saliva contact to mucous membranes. So there's a number of ways that diseases can be transmitted from rodents. And this rat here is in a Dr. Glass Lab rat trap from an investigation that we collaborated on a few years ago. So now I want to spend the rest of this presentation discussing hantaviruses and give an example of a hantavirus investigation that we conducted in Maryland. So hantaviruses are RNA viruses. In the United States, most typically we think of Synanthropic virus, but there are approximately 60 hantaviruses worldwide. And the rodent reservoir for each of those hantaviruses is going to vary. So the deer mouse is the rodent reservoir for Synanthropic virus, and the Norway rat is the rodent reservoir for Sol virus predominantly. But there are many, many other hantaviruses, and again in the US we most typically think of Synanthropic virus. The transmission of these viruses is via aerosolized rodent excreta. Now, the two clinical presentations I want to focus on are hantavirus pulmonary syndrome, which is what is most typically associated with Synanthropic virus that we see in the US. So most cases of hantavirus in the US are hantavirus pulmonary syndrome. And this is typified by an abrupt onset of respiratory distress, and typical features are fever, cardiac insufficiency, pulmonary capillary leakage, which can often result in shock and death. The second presentation I want to focus on is hemorrhagic fever with renal syndrome, and as its name suggests, has a kidney involvement. So fever, shock, and renal insufficiency are typical features of HFRS. HFRS is commonly associated with several different hantaviruses. There isn't just one hantavirus that can cause hemorrhagic fever with renal syndrome. And some of those include Sol virus, Hantavirus, Pumila There are a number of different hantaviruses associated with HFRS. Now, hantavirus is nationally notifiable, and it's also on Maryland's list of reportable diseases. In any year, we'll typically see 25 to 40 U.S. cases, and approximately half of those are in the western part of the U.S., and they are pretty much almost 100% of them are hantavirus pulmonary syndrome cases due to the Synanthropic virus. We don't have any cases of hantavirus pulmonary syndrome reported yet in Maryland, but we have had local hantavirus pulmonary syndrome cases in West Virginia, Pennsylvania, and there was a suggestion that a Pennsylvania case may have been exposed in Maryland. So even though this is most commonly found in the Southwest and in California, it's not a problem exclusive to that area, and it's certainly possible here on the East Coast. Again, it's persons who are in areas contaminated with excreta who are most at risk. So this is a case report of a hantavirus case that occurred here in 2008. It's how I first met Dr. Glass. This was a 22-year-old male who presented to the emergency department with 3 days of cough and fever, and he was noted to have wheezing, and he was given bronchodilators, nebulized, and he was discharged. However, he came back 3 days later complaining of nausea, vomiting, crampy abdominal pain, diarrhea, headache, sore throat, persistent fever. He really complained of diffuse muscle aches. He also had a non-productive cough, and he reported dark urine. In the emergency department, his blood pressure dropped, and so he was admitted, and what was noted from blood work on his third day of symptoms was that he had increased white blood cells and decreased platelets. He also had some evidence of liver and kidney and muscle breakdown. He had elevated transaminases, creatinine, and creatinine phosphokinase levels. On his sixth day of symptoms, he was noted to have decreased urinary output, and he was diagnosed as being in acute renal failure attributed to rhabdomyolysis, or breakdown of skeletal muscle. And so he had to be dialyzed. He received a total of 6 dialysis treatments. Now, laboratory findings, he came in presenting with some respiratory signs. He also had some gastroenteritis signs, and and then his blood work suggested some problems with liver, and so a number of different infectious diseases were tested for. You can see that blood and urine cultures were negative. Many of the respiratory pathogens that were tested for, or all of the respiratory pathogens that were tested for, were negative. It's negative for hepatitis A, B, and C, and negative for leptospirosis. Now, there was some suggestion that he was had rodent contact, and so the clinicians decided to test for Hantavirus. And so this was done at a commercial lab, and what was tested for was antibodies to the nucleocapsid protein that's found across hantaviruses. So it was unable to distinguish different hantaviruses, but you can see that he had both elevated IgG and IgM levels to hantavirus. So this triggered a public health involvement, and so it just to, again, put it in the public health context, because this hantavirus is reportable, it was reported to the local health department in which the patient resided, and the local health department contacted the state. So at that point, the state health department was brought in, and we, in turn, consulted with the Centers for Disease Control and Prevention. CDC confirmed what we were thinking, which was that the clinical picture was consistent with hemorrhagic fever with renal syndrome, not hantavirus pulmonary syndrome. They were able to take some specimens and confirm that he did test positive for hantavirus, but actually he was negative for Synanthropic virus, positive for Sol virus, both IgM and IgG, and then we were all very excited that we actually were able to get a PCR product out of a specimen that was collected 9 days after symptom onset. And so we initiated an investigation. Now, the patient lived in one county, worked in another county, and so we had to coordinate with 2 local health departments, and then I said to myself, who can help me with the rodent part of this investigation? Aha, Dr. Glass. I've wanted to meet him. So I picked up the phone, and he was incredibly receptive to helping us. And so he and his lab helped participate in this investigation. Components of the investigation included a patient interview, visiting both the residents and workplace to assess for rodent infestation, and trapping. The patient reported or did not report any foreign or domestic travel. There was a suggestion that there was rodent exposure at work. He did not have any direct contact with rodents, and he in fact said he did not see any rodents. He worked in a shopping mall that had an underground tunnel, and he was a security guard, and he patrolled this tunnel. And other people who worked there reported seeing a lot of rodents. He denied ever having seen any. But there was no other rodent exposure. So we went out. This is Dr. Palakar, who was at the State Health Department at the time as an EIS officer who was participating, leading this investigation. And we investigated both the work site and the residents. I was not on that first inspection of the work site, but rodent droppings were visualized, poor sanitation was noted, and there were reports of dry sweeping and power washing being used to clean out the tunnel. Both of those activities would generate a lot of aerosols and potentially transmit hantavirus. So recommendations were made to control the rodent problem and to stop dry sweeping or power washing. The investigation at the residence demonstrated rat burrows on the same block as the residence, but nothing directly where the patient resided or in the patient's residence. And so just appropriate rodent hygiene was discussed with the patient and his housemates. We did trap at both locations, but unfortunately we did not trap any rats there. Oh, I'll go back quickly. This rat that we did trap was at a site identified by the local health departments as having a continual problem with rodents, and so we were able to get some rats at other sites, but not directly at the site where the patient either lived or worked. These are photos from his work site. Like I said, I was not on that first visit to the work site, but and by the time I went there, it did not look at all like this. So there's a lot of rodent feces here, rat feces, which I never saw. Here is evidence of the problems with control of sanitation and garbage. And there certainly was bait boxes. This is a rodent bait box, typically put out to bait the rats. Rats can go in, ingest the rodenticide, and come out. And there certainly was bait boxes and evidence there suggesting that they were implementing rodent control, but it was all nice and clean by the time I went. So I just want to quickly discuss sole virus in the U.S. And as Dr. Glass presented, there is 50% seroprevalence or greater in our local rat populations. It is typically associated with hemorrhagic fever with renal syndrome, but most of the cases have been reported from Korea, China, Japan, and Russia. And domestically acquired HFRS due to sole virus had not previously been diagnosed in the acute stage in the United States, although some of the work conducted by Dr. Glass showed evidence of previous infection in Baltimore patients with renal disease. So we know it's here. We know it can infect humans. The question to me is, if we do see human cases caused by sole virus elsewhere in the world, why don't we see more, since we know there's so much of it in our rats? So from this investigation, well, I'm happy to report the patient completely recovered. He was discharged 29 days after onset. I don't think it was 29 days of hospitalization. This is just a reminder to consider uncommon pathogens. We're reminded throughout veterinary medical school to think of common things that occur commonly, but also don't discount the possibility of something uncommon occurring. Collaboration was essential in conducting this investigation, and I think it's also very illustrative of how public health works with the local health department, the communicable disease folks, typically nurses in the local health departments, the environmental health folks in local health departments who will conduct the investigations and inspections, the state health department, Centers for Disease Control, and our academic partners. And so with that, I'll just leave you with this final slide, which is the resources I promised you. I promised you a lot of resources, and this is it. If you go to cdc.gov/rodents, you'll get to this nice page that goes into a lot of details about seal up, trap up, clean up, and also can talk about diseases transmitted by rodents and indirectly transmitted by rodents, and some great cleanup information. I'll leave it with one context. We often get folks calling us saying, we have a rodent infestation, how do we clean it up? And again, you want to protect against aerosolizing excreta, and so there are some very nice guidance documents on how to clean up after rodents. And so if any of you need to find that information, it's here on the CDC website. And so with that, oh, and I do need to acknowledge everybody. Like I said, Steve Haynes at Montgomery County, Valentino Cuoma and Tanya Simmons in Baltimore, Dr. Palakar, who conducted the Hantavirus investigation, and Kyle Shannon and Anna Rundle all contributed to this presentation. So thank you.
Thank you very much, Dr. Glass and Dr. Feldman. At this time, we are going to take questions from our live audience as well as our webcast audience. And for those of you who are watching via webcast, you can email your questions to MAPHTC, that's for Mid-Atlantic Public Health Training Center, at jhsph.edu. So, yeah, go right ahead.
I wanted to go back to the ideas of Kurt Richter, and I'd love to actually speak to you at some point about your memories of Dr. Richter. But one of the things that he wrote about back in the 40s was an observation that when rats got into people's houses, people tended to be exposed to more illness as well as to bites. We saw mostly outdoor scenes in the slides here where rats were congregating and rats were kind of encouraged by the outdoor conditions. But I did notice on that CDC website there was the first thing was seal it up. And so I was wondering, are people still today being exposed to rats indoors, and what kind of intervention strategies, in addition to what we've heard about, does that kind of point to? Because we mostly heard about outdoor stuff.
And if you could just repeat the question before you answer, that would be great.
Do you want to take that?
Okay, we'll let Dr. Glass follow up. So the question was indoor exposure to rats and how common that is today, because most of what was presented today was about outdoor exposures. I'll just give one bit of context. I mentioned the case of rat bite fever that occurred a few years ago. That was a Maryland case, and it was, I don't remember many of the details, but it was an infant or a young child who was bitten indoors and then ultimately died. And so this certainly does occur, and sealing it up and ensuring the integrity of that housing is a huge challenge in many of the older structures in Maryland, and so it's certainly an ongoing issue.
Yeah, the bit of information I know of associated with Baltimore on indoor infestations was part of a study that was done by another Baltimore or Hopkins seems to have just been rife with rat researchers.
One breeds another?
One breeds another. And there is a rapid turnover, so there are some similarities. Jamie Childs, who subsequently went down to Centers for Disease Control and Prevention and subsequently is up at Yale University. And he did a survey of roughly 1,200 people. It was mostly a sample of convenience, but drawn primarily from areas where you saw on the maps where rat infestations were reported. And not only did he ask people, did you have rats in your neighborhood, in your house, you know, and various and sundry other animal exposures, but he also went to people's houses and trapped in the houses. And most of the rats, and part of the reason I focus on rats outside, is that only about 5% of the households reported having rats in their houses. Even in, if you remember that slide where you had the yellow, I had the yellow arrows of the burrows, even in neighborhoods such as those, you tend not to see the rats move indoors. They do come in, obviously they do, but it's not a really common situation, and certainly not like the stories you hear in New York City. And he was able to get people to recall, again with all the caveats associated with that, about 1% of the people reported that they had been bitten by a rat sometime in their life. Most of the average age, I think, was typically people was in their mid-20s, lower to mid-20s. So you're talking about, you know, exposures typically as children themselves. So that's about the only data I know about it. And that did get published, but in a very obscure journal.
Yeah, in the white.
I heard Bobby Corrigan talk last week, the New York City rat control guru, and he said, if you find any rats in Baltimore, comb them. I said, comb them? He said, comb them. He said, we're finding oriental fleas in the rats in New York, and I don't know if you're finding them here and what they might spread.
Nope.
Nope.
That simply, it's one of the, actually, to expand upon, oh, no. I had this analysis because people were very concerned about, after 9/11, not the accidental introduction of plague, but the intentional introduction of plague. And so there was a lot of effort put into trying to anticipate what would be the impact if plague was introduced intentionally, which is actually kind of striking because, again, kind of going back to earlier conversations, that's what actually brought John Emlyn here to work with David E. Davis back during the Second World War, was exactly the same scenario. So we kind of rehash things. Anyway, in roughly 25 years of playing with rats, I think we found about 3 rats with fleas. Rats have Norway rats, at least in Baltimore, have relatively few ectoparasites except for mites. If you ask some of the old researchers in Maryland, they'll say, well, actually there was a major effort to get rid, back when you could use things such as DDT, to get rid of ectoparasites off of rats. And they're suggested, you know, that's just sort of some inertia that the fleas just never have really gotten reestablished.
Okay. Yeah, all the way in the back.
Yeah, I have 2 questions. One is, has anyone looked at an increase in incidence of rats since the city changed to once-a-week trash collection? And the second is, do you think there's any problem with the growth in urban and school-based gardens and rats?
If you could just repeat the
Sure.
question.
So one of the questions was the sort of unintended consequences associated with a lot of behaviors with people, including the shift to once-a-week garbage collection, as well as things such as encouraging people to have gardens, providing places for rats to burrow. For the former, I really don't know. I was asked about that when it was first proposed, and I had no good answer, and I didn't have any way to follow up on that before or after. I think it would be an interesting question to ask, Certainly it's one of those issues that if you can find a way not to increase the amount of food that's out there, you wouldn't necessarily expect that effect to happen. But we oftentimes forget, but was brought out with that study that Lambropoulos and the city did a number of years ago, that particularly in these urban households that are relatively small, there's not a lot of place to store refuse, particularly refuse that's edible for rats. And so it tends to basically, has the unintended consequence of putting more food out there for the rats. Has it led to a change? I don't really know. The second one, again, sort of anecdotally, I know when, I am so old that I remember when Charles Village was rediscovered by the young urban professionals and rehabbed. And certainly one of the things that happened is people tore up the concrete in the backyards and their parking pads and put in nice gardens, places they could sit at night, was that they did introduce places that the rats could burrow. That's not an insoluble problem if you're aware that your behavior is making the environment more suitable for rats. You can garden in ways that kind of minimize that hazard. But it certainly is a situation that can happen.
Okay, we do have some questions from our online audience, so I'm going to read a couple of those before we get to some of the others from the live audience. And there's a question about rabies and whether there's been any reported cases of rabies in rats in Maryland or elsewhere, and how prevalent is it, and if bitten or scratched and the rat escapes, is preventative rabies treatment recommended?
Do I need to repeat that? No, that all went in because you have the mic. Okay, great. So the question is about rabies and rats and rodents in general. So typically, rodents are far less susceptible to rabies than some of the other mammals, but all mammals are susceptible to rabies, and we have had documented positive rabid rats in Maryland. I am struggling with the number of them. I think we've had 2 or 3 over the past 40 or 50 years. So it certainly has happened. We don't discount it from happening. So if anyone is bitten by a rat and the rat's not available for testing, we will do a thorough risk assessment and determine whether it was a provoked bite, look at the situations of the bite, and determine whether rabies post-exposure is warranted. But it's done on a case-by-case basis, so I would urge anyone who's in the situation to get in touch with your local health department and go through this risk assessment process. So it's not likely, but it's also possible.
Okay. And then we have a question for Dr. Feldman. Does the city have sufficient resources to deal with the rodent issue? With 28,000 complaints, there would be more than 50 complaints a day. How many city workers handle rodent inspection/baiting, and is the operation protected from budget cuts?
Right, and unfortunately I cannot comment on the city's budget situation. I work for state health department, and that's not part of my purview.
Okay.
Yeah.
There's a question about whether there's any relationship between rat exposure and cognition in children. Whether
it's a great question.
Yeah.
I mean, certainly, if you look at those maps of rats, the rat complaints, they mirror, crime rates, drugs, lead paint exposures. I mean, basically, they're part of sort of the whole general milieu of major social problems. And so kind of teasing those out, I think, would potentially be an interesting question, but I'm not really sure that anybody's tried to do it.
Okay. And there's a question about the collateral damage when rat poisoning is entered into the local ecology and the effect to children, pets, and other animals for having the rat poisoning put out.
I think it's another one I'll let Dr. Glass answer because he thinks ecologically. But along the lines of thinking ecologically, one always has to weigh one's prevention methods and control methods with risks and benefits and how that fits in, and you can minimize the risks.
Yeah, and I think that the issue of the use of poisons and how they get used and when they get used and collateral damage, as you say, to non-target species, including young humans, and not even so young, has always been sort of at the basis of a big problem, and certainly has, at one level, driven the evolution of the kinds of poisons that are available. In the not-so-distant past, part of the reason, for instance, that Davis and Emlyn and so forth could get such dramatic effects was they were using highly toxic poisons, and actually the history of rat control in Baltimore City is rife with concerns about pets getting poisoned, children getting poisoned, and so forth. Coupled with the move towards trying to find less toxic, for particularly humans, poisons have been sort of the consequent effects that the workers who do that work have to come back more often and repeatedly, and particularly when budget issues come into play, it means that their time is tied up retreating multiple places. And I think that certainly has been a tension that we need to be particularly aware of when we talk about the communities that are most at risk. Part of the reason I normally use that slide of the backyard is just sort of as a horror story of what happens when you have sort of uncontrolled, uneducated use of poisons. On the other hand, we could also see the potential consequences of trying to regulate who can put out poisons, particularly on their own property, in that many of the neighborhoods where rats are a problem, people can't necessarily afford to pay the price of having exterminators come on a very regular basis. And so, saying that they can't have access to it raises a number of other social issues that we need to deal with.
Okay, thanks. Did we have more questions here?
I guess it's part epi question, part ecology question, but you mentioned that most of the cases of hantavirus reported worldwide are out of Asia. If, let's say, infestation levels are the same in U.S. urban centers, why do you think there might be a difference in the reporting of cases, either surveillance or ecology?
So I'm using your question, Alvina. The question was, and so for clarification, the cases I spoke about are hemorrhagic fever with renal syndrome due to Sol virus, are mostly out of Korea, Japan, Russia. But there are plenty of other hantaviruses that cause disease in the Americas, South America, and so it's not just an Asian problem. So the question is, why do you think there are cases there and we're not seeing them here?
Well, we do mostly, but from Greg's work, we know that the Sol virus is in the rat population at a very large prevalence in Baltimore, but we don't get a lot of reports of cases. We rarely, actually, I think that was the first one ever.
Right, and so the question is, we see cases not uncommonly in Asia of HFRS due to Sol virus. We know Sol virus is here in our rats. We certainly have plenty of people who come in contact with rats. Why don't we see more Sol virus disease in people? That's a great question. That's my question, and I think Dr. Glass has the same question. Maybe he has an answer.
I'm from Hopkins. I always have an answer. It may not be right, but we never admit that either. Keep forgetting this is going out live, isn't it? Sorry, Mike. Actually, since you mentioned ecology, I think it actually points out a very interesting point, and that is the distinction between rats being infected, which is what the serology is showing, and being infectious. And I think there's been a fair amount of work, again, particularly by Sarber Klein, showing that rats do get infected. Obviously, prevalence based on serology indicates that transmission goes on very dramatically. But within about 30 days or so, the immune system, particularly in female rats, is able to downregulate the shedding of virus. The animals are never able to actually clear the infection themselves, so you could think very much along the lines of a model like chickenpox, where the virus remains quasi-latent. So they've been infected, but they're no longer infectious. And so if one goes out and does a serosurvey, one gets the impression, or even does PCR, one gets the impression that there's a lot of infection in the rats, but there's probably not a lot being put out in the environment at any one time. Jamie Childs actually suggested that because most rats live outdoors, that the virus that's getting shed out in the environment tends to get broken down relatively rapidly in the presence of ultraviolet light, sunlight. And if you go in these alleys at night, you actually run into relatively few people. And so the times when the virus is being shed out in the environment by the rats, there aren't very many people to contact it. And so although rats are all around us, we really don't come in, truly come in that much contact with that much virus. That's been one argument that's been made. But in terms of being an issue in China, I mean, the Chinese typically report, they estimate between 50,000 and 100,000 incident cases a year. So dramatic, there is this dramatic difference, and nobody's really quite sure why it's that way in China, and seems to be a relatively limited problem here in this country.
Can I make one additional comment just on the trying to determine the source of infection for our patient? We never did identify a source. We didn't come up with a smoking gun rat location for this patient's exposure. That I don't think is all that different from what happens in Asia. And speaking to some DoD counterparts who've done a lot of investigations overseas, they often don't find a source even though they go and look for their HFRS cases.
Okay. Yeah, all the way over here.
I'm curious about how distinct the link between rats and poverty really is, and how much that's a Baltimore story, and if it's similar in other types of cities to the extent that it's not really an urban rat problem, but an urban poverty story.
I need you to clarify that for me. I'm sorry.
Just the geographic distribution of rat infestations is so closely aligned with areas of very concentrated poverty and long-term poverty. And I'm wondering how much that is, it's relatively clear thinking about Baltimore, but I don't know if that's the case in other cities, and whether that's a safe link to make, or if it just happens to look that way.
Yeah, so the question was, is this a situation in which this is very much a Baltimore story in terms of rats and social condition for humans, and can you really extrapolate to other urban areas? I have to say I have a much more reduced experience. I can say if when I went to look for rats in New York City, the neighborhoods I picked or would pick with the crews there look very much like the situation that you would see in Baltimore. Fairly similar for Chicago, but there are also obviously major urban areas in North America where you don't see such a dramatic problem. Certainly if you go to Seattle, you don't see, at least I've never experienced quite the situation that you see here. And to the extent that it simply reflects some interesting, if you will, sort of academically interesting social issue relative to Baltimore, I'm not entirely sure. And obviously, if you go up to Roland Park, you can find rats strolling around Roland Park as well. So it's not strictly a matter of economics. But people in Roland Park, if they see one, tend to have the resources generally to do something about it. Now they do sometimes identify squirrels as rats, but that's why the second slide about what a rat is was in there.
Okay. There's a question about Dr. Glass's discussion of Charles Village and how people came in and dug up some of the concrete and put in gardens and living space. And if you're going to do that and then replace the gardens again with concrete, is that going to disturb the subterranean nests? And then if so, is there any hope basically for getting rid of the rats? Or
actually, that's right. So you have the microphone. The question actually is not unique just to the issue of sort of gentrification of neighborhoods and the problem it brings on. Certainly large-scale development, such as we've seen in the west side of Baltimore, certainly north of the university here, has always raised the issue that if you move people out and you do wholesale environmental modification, i.e. tear down row houses, put up new buildings, what does that do to the local rats that are there? And the simple answer is nobody is really sure what it does. I mean, the classic story is, and I heard somebody before we were talking earlier talk about the big dig in Boston. And, besides, ceilings falling in the tunnel, much before that, people were concerned about the digging actually disturbing lots of rats and causing the rats to spread throughout the city. So it certainly has been recognized, at least anecdotally, that it's a potential challenge that needs to be dealt with. How you do it on a small scale is actually dramatically different from what you would do when you do wholesale alterations of whole neighborhoods.
Okay. And then there was a question about the prevalence of LCMV in the Baltimore rat population. Do we know anything about that?
It was mine, yes.
Yeah.
So, but I was going to pause.
I can talk about it.
Yeah. No, the point is that lymphocytic choriomeningitis virus is known to occur in mice, house mice, mus musculus, small rats, as part of sort of the natural transmission cycle. And mice in Baltimore are infected with LCMV. People in Baltimore are infected with LCMV, actually at quite a high rate. But rats are not presumed to be carriers of the virus. And so actually it was included in the original study because they were finding basically everything that they looked for. They were afraid that something was wrong with their assays or their technique. And so they included a zoonotic agent that was carried by a different rodent and simply didn't find it, which was what they were hoping to see in their study.
Okay. Did we have any other questions from the live audience, from anyone? No? Okay, I think that puts us to an end then of our May Public Health Practice Grand Rounds, and I really want to thank Dr. Glass and Dr. Feldman for a terrific presentation, and hope to see you all next month for our June Grand Rounds with Dr. Phil Leaf and Jonathan Bryce on reducing youth violence in schools and communities. Thank you.